Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, seniors, and caregivers. Today, we're going to talk about the state's support of services for New Jersey seniors living in the community and in facilities throughout our state. It's important to note that less than 5% of New Jersey seniors live in facilities or institutions. Today, we're very pleased to have as our guests Lowell Arye, who is the Deputy Commissioner of Human Services, and James McCracken, who is the New Jersey Long-Term Care Ombudsman. Thank you both for being here today. You know, before we get started, I was going to ask Lowell, I got a call recently from a woman who thought we should do a show, which we're not doing today, but on the difference between Medicare and Medicaid. So can you briefly discern the difference for our viewers?
Sure. Medicare is much more of a social insurance program. It's for people who have been working all of their lives and or have been living with their spouse who has been working and paying into both the Social Security and the Medicare programs. And basically it's a program that supports acute health care needs. Acute health care needs. Things like hospital visits, physician visits, as well as a little bit, there's prescription drugs now, and Medicare Part D was enacted several years ago.
Part D being the prescription?
The prescription drug side, but it does not provide really any long-term care type services. It does not support anyone in long-term care.
So someone going into the home is not covered by Medicare?
For a few days, yes, for up to 100 days, but it really doesn't provide the long-term services and supports that most of us think about when we think about long-term care.
And Medicaid?
Medicaid is really for individuals who are poor and low income. This includes both people who are on TANF, welfare individuals, as well as people who are, as we call them, aged, blind, disabled. And so these are for individuals who have always had low income and may or may not have worked their career. And it provides both the acute health care needs, but also the long-term care needs. So it provides long-term services and supports everything from the continuum of services, personal care, home health care, therapy services, as well as prescription drugs and others. You can actually be both dually eligible, as they call it, for both Medicare and Medicaid. And those are really usually the more frail, chronically ill individuals who have really not had a lot of health care in most of their lives.
And Medicaid is an income eligible program.
It is income eligible.
That's great.
That's correct.
Well, I really appreciate it. Hopefully that will answer some of the questions that are out there, and at some point maybe we will do a show on the whole difference. But today we really wanted to talk a little bit about the state's restructuring. I think perhaps seniors and caregivers are hearing a lot about that. So maybe you can tell us about some of the changes that are happening.
Sure. Well, last September, the state of New Jersey put forward the comprehensive Medicaid waiver to the federal government. We have to get it approved by the federal government, Centers for Medicare and Medicaid Services. And what that does, basically, it includes a lot of changes, but the big change for seniors is the movement to managed long-term services and supports. So as you know, in Medicaid, we have already put many individuals, almost 96% of our population in Medicaid are in managed care. But for the acute care side, now we're moving forward and we're going to now be moving to managed long-term services and supports. So what most people think of, the Global Options Waiver, the GO Waiver, and other services that support people in the community will now be in managed long-term managed care.
And these are services that someone might get when they call their county office on aging?
That's correct. They might ask the area agency on aging for some services, and they would link them up through the ADRCs with folks from the Global Options Waiver and determine if they are eligible for services.
So will seniors notice this change?
They won't notice. Won't notice the restructuring, and let me talk a little bit more about the restructuring. the decision to restructure was, since everything's going to be going into Medicaid and at the Department of Human Services, the decision was made to take the other programs, the Older Americans Act programs, and also PAD and Senior Gold, pharmaceutical assistance for the aged and disabled, Senior Gold, which is for more moderate income individuals to support them with pharmacy benefits, that those should also come over to the Department of Human Services, so that there's just one place that seniors and people with disabilities need to go to at the state level to actually get services, regardless of their Medicaid eligibility.
Before there were two, and what you're saying is the restructuring brings everything under the same umbrella.
Well, actually, if you remember, in 1996, there were actually 3 or 4 different places, and then in 2006, it went over to the Department of Health and Senior Services.
Exactly.
The concern that we had is with Medicaid managed long-term services and supports, to move that into the Department of Human Services, that there would then be, again, 2 places that seniors would have to go to. So the decision was made by the governor that we really needed to restructure and to ensure that there's services across the board, and that there's one place, one state place in government where seniors can go to get services.
Well, I think it will be very helpful. And how will people call for services, or what's the best contact?
Well, the best contact is the old contact number. None of the numbers are going to change. There is the number 877-222-3737, and that will link people up specifically in their county. When they call in their county, it will link to their specific area agency on aging and their aging disability resource connection. And it will basically allow them to then get county-specific services, but will also give them more information for other services across the state. There are other places as well. There's phone numbers for PAD and Senior Gold, which will be also available as well. And those numbers are not changing either. So really, it's not going to change anything specifically for people. It's more just going to be an easier way to talk and work within state government.
Well, I think that's really important, because what we want to do is to make things easier for people, because I know when they call our offices, sometimes we're their first call, and sometimes they've reached out several times, so it's really good to know how people can best reach you. And you know, I really want to make sure that we're including the understanding of what the Ombudsman for the institutionalized elderly really offers, and perhaps later we could talk about how these things might actually connect. So Jim, I'm really happy you're here, and
thank you.
I know the Ombudsman's office has been around for a while, but what do you see as the basic and core services?
Well, the Office of the Ombudsman is established by both federal and state law. State law in New Jersey actually preceded the federal law, but every state and U.S. territory must have a state long-term care ombudsman. And what the ombudsman does is advocate for individuals who are in long-term care settings. In New Jersey, we also investigate allegations of abuse and exploitation in the long-term care settings throughout the state as well. So in New Jersey, we have an advocacy role, and we actually investigate these types of incidences as well. Once we investigate an incident, if something is substantiated, then we refer that to an appropriate agency, whether it be a licensing agency, a regulatory agency, law enforcement, or
How many
whomever.
referrals do you get a year?
We get approximately 6,000 complaints in our office annually, and about half of those complaints that we get, we open up as cases.
Who do the referrals come from? I guess I'm just curious.
New Jersey is a mandatory reporting state. So if you work...
When you're in an institution.
When you are in an institution,
Sorry.
that's correct. So for those who work in institutions or licensed long-term care settings, social workers, caregivers, nurses, other professionals, if they suspect abuse or exploitation is occurring to a resident of that community, they must, by state law, report that to our office.
But do family members call?
They certainly do. Anybody is welcome.
And a patient?
Anybody is welcome to report those cases, and we get cases from a variety of individuals. Like I said, those caregiving professionals must report, but certainly we get calls from patients, family members, friends, and other interested parties who are concerned about someone's safety or feel that they need an advocate.
And the staff, how large is your staff to take care of? Because how many people are really in institutions that you really feel you cover?
Well, the number is close to 100,000.
I thought.
And we have an office of 31 people, 11 field investigators, but we also have a very active volunteer program.
Oh.
And presently we have 180 volunteers placed in long-term care settings throughout the state of New Jersey, primarily nursing homes, and we're actively supporting that program and looking to grow that.
What's the difference between what the volunteers do and your staff? I mean, the volunteers, do they investigate?
They can, but primarily our volunteers are trained in a number of issues. We're certainly going to be training the volunteers about the restructuring with the Department of Health and Senior Services and the Department of Human Services regarding the Division of Aging and Community Services. We provide them training on identifying financial exploitation. We provide them training on Money Follows the Person, the comprehensive waiver.
These are programs.
A number of programs and issues that pertain to individuals residing in long-term care settings. These volunteers receive 32 hours of training, plus they have a mentor, and we ask them to be in the nursing facility 4 hours a week. So they're on-the-ground advocates in the community, an independent part of a team trying to provide good care for the resident that resides in that setting.
I guess a lot of these settings probably have resident councils, and maybe they, or maybe not. And do they participate in the daily routine of the facility? These
They
volunteers?
do. They may attend resident council meetings, family council meetings. They will visit with residents. If we receive a complaint in the office and we're wondering whether or not it meets the criteria of assigning that complaint to a field investigator, our internal office staff in Trenton may call the volunteer in that community and ask them if they're aware of the situation, or ask them to do some preliminary work in looking into the matter. So the volunteers do a variety of on the ground, in the community advocacy, and they're in the settings, like I say, 4 hours a week.
And your professional staff is different. Can you describe what the composition is there?
Yeah, we have a variety of professional staff. Of the 11 field investigators that we have, roughly half of them are retired state troopers, and the other half registered nurses. So they certainly bring a wealth of experience to their role in our office. We also have a nurse investigator in the office who does administrative reviews of cases and is our technical expert in Trenton, as well as a legal team as well. We have 3 attorneys in the office.
So I don't want to say typical case, because I'm thinking each case is probably somewhat unique, but what do you see as the normal procedure?
The largest growing segment of cases that we receive in our office has been financial exploitation, regrettably. It's somewhat endemic throughout the state. I think for a number of reasons. Certainly the economy, the economic situation that we're in does not help that in that scenario at all. But we also investigate involuntary discharges, abuse, neglect. Those types of things are the cases that we see most often.
I guess I'm wondering about the extent of the time to investigate a case. Obviously some, if they're not substantiated, may wrap up relatively quickly, but do you stay involved with these cases that you feel are substantiated?
Once we And some of the cases do not take as long as others, particularly when it comes to financial exploitation and subpoenas and that type of work are involved. Those cases can be somewhat lengthy. Once we conclude our investigation, and again, I think it's important for me to say here, we conduct our investigations. Our investigation is a tool that can be used to advocate for the resident. So the investigations are certainly an important part, but the investigations are done so that we can determine what we best need to do to advocate for the resident, to make sure that they're in a safe environment, this situation that they're faced with has been resolved, and they feel that they can continue to reside in a community free from restraint in the future.
In the facility. Yeah, and because we've talked really about abuse and neglect a little bit in the facility, I really did want to maybe touch on adult protective services. I know we hadn't talked about that before, but it is different, and it is, shall I say, Lowell, it really is looking at people that live within the community but not in facilities. So, and that's coming under with the restructuring too, to Human Services?
That's correct. With the restructuring, we're taking two different divisions, Senior Benefits Utilization Management, which does PAD and Senior Gold and Lifeline, and then the Division on Aging Community Services, and making it into the Division on Aging Services. Included in that is the Office of the Public Guardian, as well as which includes the Adult Protective Services. And Adult Protective Services is more county-based, specifically looking to make sure that individuals who are not neglected in the community, if they're maltreated in the community, there's a variety of things that get investigated. And that is absolutely going to be included in our Division on Aging.
And is that with the same contact phone number, or is that a different?
That is that you can contact them through that 877 number, as well as there are other phone numbers.
Well, I think it's interesting because there are different services that are in place, and I guess what I really wanted to focus on today was that, you know, there's a commitment to serve New Jersey seniors, both if someone's in the community or if someone's in a facility. And so I think that's very important for people to understand, because people hear a variety of things. And so it seems to me that there may be some crossover too, in terms of trying to make sure that services are available in the community when someone's coming out of a facility, or someone in the community needs to a higher level of care and might go into a facility. So I'm thinking there's some crossover here.
There absolutely is. I think certainly with the move to manage long-term services and supports, we are looking to more balance between home and community-based services versus nursing homes, and ensure that people can actually age in place as much as possible. But then at the same time, I think the decision to either have someone to move someone into a nursing home to make sure that there's not financial exploitation, I think is an important piece of it. And also, as Jim talked about, the money follows the person, and helping people who are in nursing homes to decide to move out because it's better for them and they can have more quality of life, but how they interact within the nursing facility as they're moving out and what happens there. I think there is definitely an interaction between us.
And you see a role there too, and I would think.
Yeah, absolutely. You know, the goal is to provide a comprehensive senior network to make sure that not only services are delivered, but seniors have access to advocacy and protection groups and services, and we work very closely together to ensure that we coordinate those services as much as possible for the common goal of making sure that seniors' needs are met and you know, their rights are being protected.
Sure. It sounds like you really have an underpinning for your investigators with your volunteers. Is that something you actively recruit for, in terms of your volunteers that go into facilities?
Yes, we have a volunteer coordinator, Deirdre Murrah, in Trenton, and we have 5 volunteer regions. Each of them has a volunteer coordinator, a part-time coordinator as well, and we recruit for volunteers in a number of different ways, and I'm hoping that this show is we might even get some inquiry from this program.
Well, we'll be sure and put that phone number right under when you're speaking about it, because I think it is important to have the right contact, and people do want to give back, and so that's another important thing. So, but I'm just wondering, you know, as we, we really looked at some of the questions that I thought we would touch on, but are there other things that you want to talk about? Lowell?
Well, I was going to say, with regards to some of the interaction, as you heard from Jim, the Ombudsman doesn't just look at nursing homes, also looks at assisted living facilities, and I think that there's discussion in the Older Americans Act about, with the reauthorization, to actually expand that focus a little bit more. So I think there's going to be a lot more of that discussion down the road.
You also go into boarding homes.
Right.
Class C boarding homes?
Residential healthcare facilities, the state's psychiatric hospitals and developmental centers, and also adult medical day centers as well.
So I think that's a good point that you've raised, Lowell. I think it really is a very wide picture, and I imagine that hopefully your volunteers will increase as opposed to your referrals from the show. But anyway, and you know, I think that you know, it's a very important role, and you know, is there something you would like our viewers to really know besides calling you to volunteer?
In addition to advocating for residents in the state's long-term care communities and investigating abuse, neglect, and exploitation, we also have a very active program that's available for long-term care providers and residents in long-term care communities regarding ethical decision-making, particularly when it comes to end-of-life care.
That's true.
So we have approximately 10 very active regional ethics committees throughout the state of New Jersey that are also staffed by trained volunteers. And this is also a service that's available to people as well. We certainly see a lot of cases in our office that involve very, very difficult situations, and it's nice to have the regional ethics committees available as well as an additional resource, people who are independent of a situation, who can come in to look at a person's situation independently and do their best to identify what this person's wishes would have been, because typically they are not able to communicate what they would be. So that's another valuable resource that our office provides. And we're also attempting to do, we are active in providing a lot of public education, particularly when it comes to advanced care planning and making wishes known. That is a conversation that people have to have annually or at least very often with someone who may be placed in the position to make decisions for them as well.
Right. You know, we just did a show that aired, I think, a month or so ago, and really talking about what people need. And, you know, it was interesting for me to realize that people needed a HIPAA release form. In other words, it's one thing to have a health proxy, but who can check on my care if I haven't identified my daughter or my other daughter or a good friend or a neighbor? You know, they're not going to get the information because I didn't do a HIPAA release form. So I imagine there are, you know, cases like that where somebody's calling because the nursing home won't necessarily tell them anything because that form's not in place.
Very important to have your wishes not only documented and have forms accessible, but also to have those conversations with the person so they're not faced with the situation of having to read a document and interpret. They're not easy conversations to have, but they're necessary.
You know, I do see a great deal of crossover, and Lowell, you mentioned the public guardian, and I'm just wondering, is the public guardian sometimes in charge of individuals that might be in facilities?
Yeah, certainly. There's a lot of, many times the public guardian will have the financial resources, will end up having the finances of the individual. And so certainly if they're in an assisted living facility or a boarding home or even a nursing home, it's very possible that they could, that person could be part of that. So absolutely.
Yeah, I mean, it's just, you could just see how someone could go from a community setting have a fall or some incident, be in an acute setting, need rehab that is not necessarily long-term rehab. And so you could see how they could pass through all of these settings where they were receiving community services and now they're in a hospital setting. You investigate in hospitals?
We do not investigate in acute care hospitals, not the Office of the Ombudsman.
Okay. And so, but when they go to rehab, that would be a situation, if needed, you would investigate
Yes.
in a rehab facility. And then hopefully they would get the services in place that they need to go home
Exactly.
from the long-term care services. So you can see it's kind of a circle, which is nice to know that it's there, a kind of a safety net as well.
And I think that's a good way to put it. I never liked the idea of a continuum of care for the elderly, because that kind of goes. There's one end to the other, and it really is a nice way to explain that there is a circle of services for individuals regardless of their situation, and that it allows us, and there's truly a commitment in this state to move forward on those kinds of things and to ensure that there are safeguards in place for individuals throughout that circle of services that we've put into place and we're going to continue to put into place.
Yeah. And there are senior centers, so there's a very local emphasis in terms of what senior centers do, in terms of what county offices on aging do, and then there is the underpinnings of the state. And there also is federal money, there's county money, and there's municipal money. And so it's just a lot of support, I think, that people are recognizing that this is a very important service. So I just want to, any last minute phone, all the phone numbers will be listed in the end of the show, and hopefully they will be able to reach out to you if they need to. So I would like to remind you, if you want to find any services in your area or any information, please contact your county offices on aging, which are also called the Aging and Disability Resource Connection, and you can reach them by calling 1-877-222-3737. And to find out more information about the New Jersey Foundation for Aging and our work, please visit our website, which is www.njfoundationforaging.org. Once again, we appreciate you for joining us for this edition of Aging Insights. Until next time, take care, and remember, aging is everyone's business.